All right, let's talk about the prevalence of schizophrenia as well as treatments for schizophrenia. So, the prevalence worldwide, about 1% of the population is diagnosed with schizophrenia, and in the United States of America, approximately 1.2% or 3.2 million of Americans have schizophrenia. So, it's not a terribly common disease, however, it can be a serious and chronic one. Personally, I do not know anybody that has schizophrenia, but 1.2% of the population, or 3.2 million people, it still does affect a lot of people. So let's talk about medications as a form of treatment. The first kind of medications that can be administered are antipsychotic medications. So I'll run through these and I'll try my absolute best to pronounce the names correctly. So these antipsychotic drugs will reduce or improve the symptoms of certain psychiatric conditions. The first one is paraphenazine, thiordazine, ariprazole, prochlorperazine, clozapine, and those are all the medications I have here. If you would like to look at those and read more in depth on those and make sure I was pronouncing them right, the link to my sources will be on one of my slides, so feel free to go through and look at those. Another kind of drugs that can be administered are anti-tremor drugs, and these are going to help control tremor, shaking, and unsteadiness in schizophrenia patients. And the drug that can be administered is benztropine, and that's also commonly administered for people that have Parkinson's disease, but it also can be given to people that have schizophrenia. So the specialists that people with schizophrenia can see are psychiatrists, and these typically treat mental disorders primarily with medications. So they're going to prescribe those types of medication, and a clinical psychologist can treat mental disorders primarily with talk therapy. So let's go into the different therapies I have here. A support group is one way. It's a forum for counseling, sharing experiences among people with a similar condition or goal, such as depression or weight loss. There's support groups for many different things. Alcohol Anonymous, people that have trouble with alcohol or drugs, people that are trying to go through weight loss, people that struggle through depression, or people that have schizophrenia. So a support group is one way. Rehabilitation therapy, so retraining the brain's pathways to improve both mental and physical functioning after an illness or injury. Cognitive therapy is just talk therapy that focuses on replacing negative thoughts or distorted thoughts with more positive or accurate thoughts. Psychoeducation is another form, that's education about mental illness that helps support and empower the patients that have it. Family therapy, that's psychological counseling that helps families resolve conflicts and communicate more effectively. Behavior therapy, which is a therapy focused on modifying harmful behaviors associated with psychological distress. And group psychotherapy, which is talk therapy, where the therapist works with clients in a group instead of a one-on-one setting. So those are many different therapies that can be used to help treat schizophrenia. Now let's go into some psychosocial treatments. Let's see here. All right, so there's lots of different I mispronounced that, psychological treatments. I got into the therapies already, but let's go through the different treatments here, and bear with me because a lot of them do sound similar, and it might take me a few minutes to go through all these, so just bear with me. Again, I will include the link, so if you want to go back through and look at the notes, you can go right ahead. So the first form of treatment I have here is called Assertive Community Treatment, or ACT, for schizophrenia. So with this, It's a multidisciplinary team approaches to intensive case management in which the team members share a caseload. So this is different. It's a group sharing that caseload. There's lots of patient contact, very high frequency, and typically for that it's at least once a week. Very low patient to staff ratios, and it provides an outreach to patients in the community. So on the ACT team, there's going to be a psychiatrist as well as other mental health clinicians. This team approach, it allows for integration of medication management, rehabilitation, and social services. So you're getting all three of those things in this treatment, and it's ongoing rather than time limited. So it's available 24 hours a day. So if you need to talk to anybody whenever, you can do that. And it's very individualized. It's very customized to the client's needs, which are constantly changing. And the goals of this treatment is to reduce hospitalization rates and help clients adapt to life in the community. So this treatment is going to be most appropriate for individuals who are at high risk for repeated hospitalizations and that are having difficulty remaining in traditional mental health treatments. All right, the next one is cognitive adaptation training, CAT, for schizophrenia. With this one, there's not as much research to support. There's more modest research, but let's get into it. It's designed to improve everyday functioning by teaching the individual that has schizophrenia to use strategies that compensate for and work around the cognitive deficits associated with schizophrenia. So these treatment plans, they're based on the assessment of the individual's level of apathy versus disinhibition, as well as the level of problem-solving impairment. With this, a therapist goes into the patient's home or their work and devises compensatory strategies for addressing the challenges that they face. So an example of that would be if a person is having trouble initiating self-care activities, signs and checklists can be used to help cue them to remember and to use and sequence the activities that are placed in plain view. These are placed in plain view where the activity is going to take place. So they're going to have that checklist in front of them to help remember what they need to do. So the intervention, typically it takes place